What is well-being? According to Canadians, it is defined as the presence of the highest possible quality of life through a wide range of domains.
I'm very pleased to be here today. I'm a physician, trained in infectious diseases and internal medicine, and I've had a very fulfilling career working as an infectious disease physician. I'm a professor at the university and in departments of med micro and the university in internal medicine. And I've had a chance to work in public health at a lab and in the Department of Public Health and do research as well. So I've been fortunate to have a wide range of exposures to the health system and to see people in their health situations in which they find themselves. I'm also very fortunate because I'm executive director of the Manitoba Medical Service Foundation, which is a foundation that's supported by Manitoba Blue Cross. And that's one of the reasons I'm here today, is to just show how Blue Cross has benefited the community of Manitoba, especially through the work of the Manitoba Medical Service Foundation. Let me go back then to, I think, an overview of this Canadian Index of Wellness, because I think it's really a kind of dashboard, really, that's intended to be a platform for examining a wide range, holistic aspects of health. And so I compliment Manitoba Blue Cross, first of all, in engaging University of Waterloo in applying this to Manitoba and starting this process. I think it's a wonderful idea. It's very educational, and it does provide important points for discussions. This was obvious last year when in June we had this workshop, and this workshop brought together over 50 people. We could talk about, from many different perspectives, broad aspects of health. So it was a very good opportunity to learn and listen and to understand all the different various components that go into wellness. So compliment Blue Cross in pulling this all together. And I think it's going to be something that will be beneficial for the long term to see how we are doing against objective and subjective measures. I think it's important to understand that this report, as I see it, is up to date to 2020 from 1994. So what's happened since 2020? You asked me specifically to talk about healthy populations. There's been major impacts since 2020. We've just come through a pandemic. And so that's inevitable that it's going to have impacts on populations. So what are some of those impacts? It likely will show a deterioration in our population health because of several factors. One is simply mortality. Mortality is one of the 8 elements of the population index. There likely was increased death rates. Morbidity is also probably worsened because people were in hospital sometimes for a prolonged period of times, and then recoveries were long. We're also dealing with several other challenges in our health system. We have what's called a syndemic. So this is an epidemic of both injection drug use and related side effects of things like infections. So right now we have very high rates of syphilis, HIV infection, hepatitis C infection as a result of injection drug use because of cocaine and other drugs that are being used. Methamphetamines in particular have resulted in many injection drug related side effects. So these are very challenging things that will impact the population health index. The other things that have resulted from the pandemic are issues that affect mental health because people have been isolated, they've been cut off from families, they've had to deal with grief, they've had to deal with sometimes job losses, career losses. So it's been a very difficult time for people's mental health and well-being from that perspective. So I think there will likely be some deterioration in our index. So that's a bit of background we can anticipate. So what's being done about all those things? One of the other factors that creates population health is the health system. And a result of the pandemic and the stresses and some burnout, the health system is under great stress. So that's another one that likely will show deterioration. But I think there's some good news. I think there's been a change in attitude. I think we're now seeing that the health system is trying to listen to frontline healthcare workers. That's been a huge change because for a long time, people felt ignored. So this listening and learning from the frontline staff is very important. There's also been some major changes in recognition that there needs to be long-term support, direct, visible support, tangible support. There's long-term contracts for doctors and nurses and other allied healthcare workers. That goes a long way to showing that there should be some stability for the healthcare providers. And I think there are other avenues now for healthcare workers to try and improve their health security at work and their well-being at work. So I think people are trying to pay attention to the healthcare workers who are the foundation of the health system. Other areas of hope, I think there's been still ongoing progress in science. There are new medications and new treatments. People are living longer and through difficult diseases, but there really are very major improvements. We've seen a whole series of new drugs that will help treat obesity and diabetes, cardiovascular diseases that are starting to be introduced. And there are new vaccines like RSV vaccines. And there are innovations in healthcare delivery. As a result of COVID, we had to do things virtually. So this opened up an opportunity for virtual healthcare, which we never had before. And so this has made things more efficient in many ways, reduced travel time, meeting time, and enabled patients who have mobility issues to enable them to contact their healthcare provider more readily. So there have been major improvements as well over time. Well, what the public probably doesn't really know is that the mission of the Manitoba Medical Service Foundation grew out of many years ago, private insurance company the doctors started before Medicare. And when Medicare came in, the doctors no longer needed that private insurance. So the leftover capital, instead of being returned to physicians, was gratefully and graciously granted to form a foundation for the benefit of health research and education for Manitobans. And so we built on that over the years, and the Blue Cross has supported that mission to improve the health of Manitobans through research and education in health. So that's what our mission is, and we do that primarily by supporting new investigators. Let's go back to one I was personally involved with. It was an outbreak of a sexually transmitted infection called chancroid, which was funded many years ago. Dr. Ronald, Dr. Wilt, and myself were involved in this project. We managed to deal with this outbreak, and Dr. Ronald was invited by the World Health Organization to expand this knowledge that we had learned here into other parts of the world, in particular Africa. And he set up a research project with the University of Nairobi, and that has continued over 40 years. And it has been a collaborative process that has helped to develop African researchers, and Manitoba continues to be involved in that program. The other benefits of that research program have been actually program development here at the University of Manitoba, because there have been many researchers trained in the area of sexually transmitted infections and other communicable diseases. And that has led to expertise, has led to the establishment of great laboratories, and also, for example, the development of the National Microbiology Lab. It was attracted here in part because of the expertise of all the infectious disease physicians, led by Dr. Ronald and the team that he has built over many years. A second area is the program development by Dr. Dalla at St. Boniface Hospital and the research center there. Over 30 researchers have benefited by MMSF grants or career awards, and they've had an outstanding contribution to cardiac health, heart health, and related conditions and areas of research. One of the leaders at St. Boniface Hospital was Dr. Grant Pierce, who was the first recipient of a career award for basic science. He's gone on to receive recently the Order of Canada for his work as a leader in nutraceutical research, especially, for example, showing how flax can benefit heart health, blood pressure, blood glucose, and other many activities that he's done. So there's been a long list of people who've benefited in the cardiovascular sciences from grants. A current lead is Dr. Michael Schubert, who his first research grant was from MMSF. So there's a long line of successes there. There are some recent investigators who've done amazing work. Dr. Megan Azad, for example, is an individual who received her, I believe, first grant through MMSF and the Children's Hospital Research Institute of Manitoba, SHRIM. It was a jointly funded grant, and it was on the breast milk properties of breast milk. And she's gone on to recently receive recognition from the Gardner Foundation as a Momentum Award. This is a very prestigious organization in Canada. And so she's now got international projects of collaboration and the study of breast milk, how it's beneficial to nutrition and to preventing asthma and preventing infections and minimizing obesity in children. So these are internationally significant impacts from a grant that was very recent, actually. And so it speaks really highly of the capacity we have in Manitoba for excellent researchers and to have both local and international impacts. I think Manitobans are, like many people in our world these days, probably confused by what is truth, what is information, what is real science, what is fact, what is fiction. And so I would encourage Manitobans to try and get important and relevant sources of information. And I noticed that one of the, again, attributes that Blue Cross has put forward, they've not only stimulated this wellness report, but they've also put in practice programs and services that follow up. So there are programs on individual wellness, information for individuals, and programs for workplaces. So try and support people. So that's one area as an example where, there is some important information that can be useful to individual citizens and patients. There are many other sources of information, but the real sources of information ultimately come from research and proper research. And so there are good sources of research, and then there's translation of that research into practice. And so that's not always easy to get, but there are scientists and researchers who can help with that knowledge translation piece so we all understand it, so that we can enact upon it. And so what I hope is that people will understand that there are truly good sources of information. You might have to look them up. And I would like to comment on, what I think Manitobans would hopefully learn is that research is a worthwhile investment, and it results in progress. We've many examples of, again, Manitobans who've made local and international progress in helping to push forward our health. And that is not done alone. It's done in partnerships. And one of our vision statements is that we will support health research and education in collaboration with other organizations. So we work very closely with universities of Manitoba and Winnipeg. We work very closely with other foundations. I'd like to give them credit: Winnipeg Foundation, Children's Hospital Research Institute of Manitoba. Without their support and some of these projects, they wouldn't be possible to spread ourselves and do as much work. So we very much value the collaboration. And our ultimate supporter is Manitoba Blue Cross. It's been with us for over 50 years, and it enables us to move forward on all these areas. So again, Blue Cross needs major recognition by the public. Both Manitoba Blue Cross and Manitoba Medical Service Foundation are not-for-profit. Our board is all volunteer, and we do it out of trying to give back to our community and to be trusted members of the community. So if you can follow some of our work, please go to our website, MMSF.ca. You can find about all our programs, all the past recipients of our programs, and they are doing wonderful work, and we try and acknowledge our collaborations and partners there as well. Let me just speak briefly to the programs we have. We support people across the continuum of their development. So our programs start off with support for Bachelor of Science in Medicine and Bachelor of Science in Dentistry programs. These are summer programs that are supervised by faculty in areas of dentistry and in medicine. And these programs give a summer experience to second-year medical and dental students. This is the first research experience many of them have had, and they quite often find that they thrive on that kind of environment of discovery and learning. And so this continues on for 2 summers. They write a report, and our resources are pooled with many others, again, to help this program along. Then we have supports later on when people are new faculty. This is our major program, actually. It's for operating research grants, and it's a 1-year grant. It lasts to provide seed money for many of these innovative ideas. We have a unique review process where we have 5-person panel. We get to meet the person. It's not just a paper transaction. We get to hear the project, to hear the communication, see the passion of the researcher, make sure they know their topic, and then we pick the best of them. And so this is our major program. We have career options for training. These are 3-year awards, and these are for individuals who are further along in their training and faculty positions. This gives them a major leg up so that they're competitive nationally, because it enables them quite often to develop more of their time for specific research activities. And we also have major recognition awards throughout all those different stages for people who are excelling and who need just a bit of a boost, that they're on the right track. We're basically trying to mentor their successes, and we work with the supervisors of these trainees to ensure that they're moving along. We have a career training award for clinicians at the very senior level of their training, at their R6 level. So these are individuals who eventually quite often become our leaders, clinical leaders. They provide direct care, and many of them have gone on to be heads of department and leading programs at the university and at the hospitals in our community. So at the various stages, we try and provide supports. So overall, we have opportunities to support young investigators and trainees, and we wish to encourage people to seek a career in the health sciences and to look for opportunities for research. There are ways to help develop those skills. And I do want to say that the results of some of those programs, again, there's great economic benefit back to Manitoba. We have provided altogether over $24 million worth of grants out, but with one of our programs alone, the research grants, we found that for every dollar we invest, the researchers bring back $9 to Manitoba. So it's a very economically favorable ratio of results from the outputs of the people that we fund. So there are many benefits, not only direct health services and innovation, but also economic benefits as a result of our programs. I think our overall purpose with some of our awards is their seed money. They're not a lot of money sometimes, but they help establish start. They give initial encouragement, and with the support of their mentors and their supervisors and the other organizations we work with, we're trying to create a community of researchers. And in Manitoba, it's a very collaborative community. It's a wonderful community. And once people get to be part of it, we hope they become established and develop roots, sink roots into the community. They become part of our community, and they will stay here. And so that's really important to our health system. We need sustainability to our health system. And so that's why these early awards and grants and mentorship are really important for the long run, not just for the research, but for people who are actually able to provide services.